Hi, do you have stiffness in your neck, back or knee? Do you work in an office chair for long hours? Now, working as a physiotherapist for the past 7 years, I've seen clients from all walks of life, and they always complain the same thing to me. They always complain of stiffness in the back when they wake up in the morning. They complain of stiffness or even pain on the knee when they try to walk after sitting a long period of time. Some even have to limp when they wake up in the morning for the first few steps because they have pain on their heel. So when you don't move for a long period of time, the circulations in the joint becomes stagnant and inflammatory waste accumulates in the joint. When you want to move again, you'll feel stiff or even pain. But once you start moving, the circulation improves and you will feel much better. Usually, the body will self-recover after some time with simple remedies. But if you realize that it is not getting better after some time, you should get professional medical attention. Here at the Pain Relief Practice, we recommend using our signature radiofrequency treatment to facilitate with your healing process. Radiofrequency therapy helps in two ways. First, it stimulates faster healing process by increasing your cell metabolism. Second, it provides deep heat that reaches into the joint to increase the blood flow and nutrients to reduce inflammation. We have over a decade of clinical experience, validated by international clients in multiple clinics in Singapore, Surabaya, and Jakarta. Our proven track record allows us the confidence to speed up your recovery process and help you achieve your treatment goals faster. If you would like to find out more, simply give us a call right now.
大家好，我是乒乓球队的于梦雨。
I'm Wong Xingru, a national table tennis paddler for Team Singapore.
一般我们受伤的部位有背部，然后颈项、肩膀，还有膝盖、手腕。
Some of us suffer from tennis elbow and back injuries. It cannot help us with the intensity of our training if we suffer from such injuries.
非常感谢 Pain Relief 的帮助吧，然后每次去的时候，都会有专门的物理治疗师帮我们放松肌肉，然后也帮我们做一些理疗。
By having Pain Relief providing us with physiotherapy services will help us to keep up with the intensity of our training and competitions to help us perform better. Hi, I'm Wong Xingru, a national paddler for Team Singapore, and I'll see you in the next video.
Hi, welcome back to the Pain Relief Practice. So today, we are here to talk about other types of pain relief treatments that we provide for our patients. So the first type of treatment is the partner-assisted stretching. So the physiotherapist will do an assessment and analyze which muscles are tighter than usual. The benefits of stretching is to improve joint range of movement, blood flow, reduce muscle tension, improve muscle coordination, and reduce the risk of injuries and soreness before and after activities. The second kind of treatment is to use percussion therapy with the use of a massage gun. Percussion therapy uses rapid pulsing effects to bring faster relief deep into targeted muscles. The treatment also releases trigger points and softens muscle tissues with increased stiffness. The benefits of percussion therapy increases blood flow, removes lactic acid buildup after a tough workout. This will work in tandem with stretching to relieve muscle soreness and pain. The last type of treatment is the Kinesio Taping. Kinesio Taping helps to alleviate pain and facilitate lymphatic drainage by microscopically lifting up the skin. The benefits of Kinesio Taping helps to reduce swelling, pain, inflammation, and it can be used for both sport and mechanical injuries and post-surgery recovery. It also provides support for muscles and helps to activate them to allow lesser restriction in movement through range. All these treatments can be used on students, adults, athletes, and sports enthusiasts. That's all the time we have today. See you in the next video.
Hello, good afternoon, everybody. My name is David. I'm the speaker for our talk for today. And today we'll be talking about the new treatment options for back pain that you've not been told about. So before we start the talk, I just want to do a little bit of a technical check to see whether you all can hear me. So also a chance for you all to try the chat function. So on the side of the chat function, if you can hear me, just type yes. And once I get a reply from everyone, I can start. So if you can hear me, type yes at the chat box. All right, thank you very much. Okay, so yeah, just a bit of a sound check before we start the webinar. Okay, but before we start, also let me introduce a little bit about myself, so that you have a little bit of an idea of what this face on your screen is talking to you. My name is David. I'm a physiotherapist. I have been a physio for the past 9 years. I started out studying in Australia in Curtin University. And part of my honours project was to do with chronic low back pain. So after I graduated from university, I came back to Singapore to work in Tan Tock Seng. And I worked there for about 5 years. So I have a range of experience. I didn't just do musculoskeletal kind of physio. I have experience in neurology, cardiopulmonary conditions and things like that. But at the end of the 5 years, I decided my interest and my passion was in musculoskeletal conditions. So that's where I left for private practice. And it's in private practice where I had a chance to really hone my skills and really sit down and reflect on what I was doing. And that helped me to be better as a physiotherapist, and also helped me to make sense of a lot of the conditions that I see outside. And that's why today I want to share my experience with you all as well. So yeah, that private practice, I've been out in private practice for the past 4 years. So altogether, I've been a physio for 9 years. And yeah, I want to share with you my experience in terms of dealing with back pain and also talking about what this back pain thing is about. Okay. Before I continue, let me just tell you a little bit more about our clinic. We're the pain relief practice. We are based in Orchard Road, and we have been operating since 2007. And to date, we have seen more than 50,000 over sessions of physiotherapy. And we also see people from all over the world, not just in Singapore, but also from the US, UK, and also from Australia as well. Okay, and we do have branches in Indonesia as well. If I'm not wrong, we have 3 to 4 branches in Indonesia, in Jakarta and Surabaya. I think it was earlier on in the intro video. We also provide services to the Singapore Table Tennis Association. We are the official physiotherapists. So when their athletes do have any injuries and they have troubles with their training, they come to us and we provide our treatment for them. So this is some of the local table tennis players that do come to us. Our physiotherapist is also very experienced, and he shares his experience with people through the media, public media. So he's gone on radio talk shows, and he also shares some of his knowledge through the Chinese newspaper. Okay. And some of our local celebrities also come to us to seek treatment for us. They trust us with their treatment, and they're actually very happy with their results. So yeah, this is quite a famous Mediacorp actor, if you know who he is. Okay, but enough about the clinic and about me. Let's talk about what you are interested in. So today you're here to find out more about treatments, new treatment options for back pain. And I'm going to share with you our complete approach. It's a very holistic approach to how we deal with back pain that not many people tend to talk about. So I'll go through that in detail later, but basically it covers nutrition, it covers posture fine-tuning, and it also covers non-invasive therapies. So I'll go into detail a little bit more about that later. Okay, but before I can explain how all this works, I need to talk to you a little bit about back pain itself so that you know why we do what we do. Okay, so back pain, pretty straightforward. It's just pain in the back. But a lot of people have different definition of back pain. Some people say they have back pain, but they're really talking about the neck. Some people say they have back pain, but they're really talking about the rib cage area. But today I'm going to focus more on the lower part of the back. So if you're familiar with your X-rays and MRI reports, they talk about L1, L2, L3, all the way to L5, right? So we're talking about the lower part of the back, like you see in the picture, the red color region. Okay, so we're talking about back pain in that area, and sometimes that back pain can go down all the way to the legs. Okay, so back pain, very simple. When I tell people, do you have back pain, they understand what is this. But what most people don't understand is what causes back pain. Okay, so I'm going to share a little bit about that with you today. And to understand that, we need to know the anatomy of the back a little bit better. You need to know what is going on inside the back. Okay, so your back is not just one straight bone going down. There are a few components that can be sources of pain as well. So just to ease you into the subject, I'm going to do something that's very familiar with all of us, and that is the disc, right? A lot of people talk about slip disc, right, when it comes to back pain. So let me explain to you properly what a disc is, because a lot of times, especially for me, before I became a physiotherapist, and I keep hearing about slip disc when I was younger, and I had no idea what a disc was. To me, I thought, okay, this because the backbone is a bone, right? So the disc must be some piece of cartilage that's over there, right? But after learning about the anatomy of the back, it's a little bit different. Actually, it's quite different. Okay, so for a disc, if you look at the left of the picture, that is a side view of a disc. A disc sits in between the levels of the spine. Okay, so it's like a bit of a cushion. And the interesting function of a disc is it helps to distribute your body weight evenly from one level to the next level. Okay, so that is the function of a disc. All right, what makes it so different from cartilage is that disc, if you look at the picture on the right side, is made up of two components. Okay, the center part where you see the red circle on the right side, the center is called the nucleus pulposus. Okay, so that's just a fancy name for gel. All right, so the center is like a gel. That gel is a thing that helps to distribute the weight out. Okay, and that gel is surrounded by layers and layers and layers of coverings like connective tissue. So think of it like an onion with a gel center. Okay, so when we talk about this is what we're talking about, right? We're talking about this gel that is surrounded by layers and layers of wrapping like an onion. Okay, and when we talk about slip disc a little bit later, this is a bit more relevant. Okay, also I want to bring up to you that all this soft tissue, all this connective tissue, the main building blocks for all this is collagen. Okay, so collagen, we know collagen, a lot about collagen because we always look at all these cosmetic beauty products and they always tell you to eat collagen. You even have things like Beauty in the Pot where they get you to eat a lot of collagen, right? So, but collagen is not just for your skin. Yeah, skin, it has a lot of collagen, but also when it comes to soft tissue, like your disc, like your cartilage, right? Later we'll talk a little bit about that. Your main components will be collagen, all right? Okay, so that's the disc. The function of the disc is to transmit weight properly down through the spine, okay? All right. So, but the disc is not the only part of the spine, right? Another part of the spine that we have is called the facet joint. So a facet joint is just a joint in the spine that allows your spine to move. Because if you don't have a facet joint, then your spine is just one block of bones, right? It's like Jenga, one block of bones stacked on top of each other. Okay, but with joints, that's where your back can move. You can bend, you can turn, you can go forward, go backwards. Yeah, you can do all these things because you have joints. Okay, and the joints, they are similar to like your knee joint. Okay, because when you have joints, you have cartilage. Okay, you can't really see in the picture, but between the two levels of the spine, the joint, there's cartilage, there's a layer of cartilage, and that allows it to slide along as you move your back, okay? But as with most joints with cartilage, it can undergo wear and tear. So later we'll talk a little bit about that later, okay? So wear and tear, so excuse me, let me just keep this. Okay. So with cartilage, there is a chance of wear and tear. So we always hear about knee joints wear and tear. And because in the back joint is similar, you have your cartilage, there's also wear and tear involved as well. Okay, so and another thing is also cartilage is part of those soft tissue. So it can also, the main component is also collagen. Okay, all right. So when you have wear and tear in the joints and you have inflammation in the joints, it's also possible to get pain from joints. So pain in the back doesn't only come from the disc. Joints can also cause pain in the back. Okay, when the joints stiffen up and they get a bit inflamed, you can get pain in the back as well. Sometimes you see how the nerve is very near the joint. So when the joint is very irritated and inflamed, it can even send pain down the leg because these nerves that come up from the back, they mainly go down the leg. Okay, so it's not always a disc problem. It can be a joint problem as well when you have back pain. All right, so yeah, just want to keep that in mind because back pain is not so straightforward as, oh, back pain equals to slip disc. Okay, there's nerves involved, there's joints involved. Okay. All right, so that is the basic, very, very basic anatomy of the components of the back. Okay, so let's go through some of the possible conditions that maybe you have come across. Okay, so let's start with the most common one that most people hear about, which is your slip disc. Okay, so your slip disc, most people think it's like, oh, this piece of cartilage, they just slip out of the back, which already I mentioned is not really correct. Okay, so slip disc is just basically, you know, the onion layers. You start having tears because of wear and tear, or for some people, it suddenly load up the spine, and then you get tears from in these onion layers. So what happens with disc, a slip disc, is you start having tears from the inside out because the gel pushes against weaker points of the layers, and then you get tears that go inside out, inside out, inside out. Okay, so you can see the picture in our slide. We start from the left side all the way to the right side. So the left side, the picture on the top, it shows a little bit of a bulge, right? So that's what we call a disc bulge. A disc bulge is a very broad kind of pushing out of the gel. Okay, it's very broad. It hardly compresses any nerves to the point that you really need to be very concerned about it. Okay, the second one is a disc protrusion. So disc protrusion, you get more of the gel pushing out. Okay, and becomes like a pimple. Okay, that kind of pops out at the side. So that one, usually there's a lot of space in the back, especially when it comes to the spinal nerves. Okay, so even if you have disc protrusion, there's no need to be too overly concerned because very rarely I see people having disc protrusion to the point where the whole nerve get compressed and then no signal goes down and the nerve is dead. Yeah, very, very rare. Over these past 9 years, I have seen less than 10 cases that really have this real kind of compressed nerve. Okay, but most of the time what happens is for this protrusion, you have nerve irritation. Okay, So the nerve starts to get a bit irritated because that the nerve kind of rubs against it. Okay? So, and then the last one, the last picture on the right side is what we call a disc herniation. Okay, so what happens in disc herniation is, you know, all your layers, you start getting tears, and then you reach the final layer and boom, all the gel just comes out. Okay, so even then, when you have a disc herniation, right, and your gel comes out, yes, you have very terrible back pain, but you get it because the gel irritates all the nerve around the area. You get very strong inflammation, and that's where you have back pain that kind of goes further and further down the back. Okay, but for these herniations, usually there's no need for surgery. People ask me before, oh, if I have this herniation, do I need surgery to push the gel back? Usually, no. You wouldn't need to do a surgery to kind of repair the disc and things like that. Okay, basically because the body reabsorbs the gel, and you end up with just a dry disc. Okay, but the back is not, say, damaged to the point that you just collapse in itself. You just have a empty onion in that sense, without any gel inside. Okay, so these are the kind of slip discs that can happen, and very rarely you will get a very true compressed nerve. So what do I mean by a compressed nerve is when you feel that you have numbness down the leg. And what I mean by numbness is not the ants crawling kind of numbness. What I mean by numbness is really you cannot feel anything. You touch your leg, you cannot feel your leg at all. You even use a piece of tissue or use a feather and slightly touch the leg, right? You cannot feel it at all. That kind of numbness. Okay, and you also find that you have muscle power loss, meaning to say that when you walk that time, you feel that, how come I cannot lift up my toes? You keep slapping your foot on the ground, and you have no control over your leg. That is a real compressed nerve, and that one is serious, but it's very rare. I hardly see any cases in the past 9 years, less than 10. Okay, so most of the time it's a nerve irritation from the slip disc, or sometimes the disc itself can cause pain. But that usually happens when the tear goes to the outer 1/3 of these onion layers. Okay, all right. So that's a slip disc. That's the basic overview of a slip disc. Okay, the next thing that some people might come across is sciatica. So sciatica, as the name suggests, is a pain in the sciatic nerve. So the sciatic nerve is the biggest bundle of nerves that come from the back and goes down the back of the leg. So sometimes that's why when people have very bad back pain, they can have very bad leg pain as well. And the pain is like burning, or some people like have a few shocks going down the leg and they can't put weight through the leg. Okay, that's because that whole sciatic nerve is just very, 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 very irritated and very inflamed. Okay, so it's an oversensitive nerve. Not to say it's a nerve damage per se, but it's very irritated. So this is sciatica. Okay. And then if some of y'all might have gone for x-rays before, and you've seen this term degenerative disc disease, or somebody might have told you about it. So the whole idea behind this is with repeated loading on the disc, right? You will find that the disc start to dry up, and also the places where the disc attach to the spinal levels, if you see in the picture, the red color line on the bones, right? These areas start to degenerate as well. Okay, and you get a little bit of a bone spur coming out at the side. So if you look at the red color line, you see the bones look a bit rough, and they're jutting out a little bit. So that's degenerative disc disease. Okay, degenerative disc disease might sound scary, but really it doesn't cause a lot of damage to the back. Okay, so what we want to do is to kind of slow down the degenerative process. Okay, and that is done by boosting it with collagen, to give it more materials to kind of manage the repair processes. Okay, and sometimes you can get pain from degenerative disc disease, but not very common. And a lot of times most people, when you go under the MRI, especially if you're a little bit older, you'll find there's some kind of a degenerative disc disease, but I don't need you to be overly concerned about it in terms of back pain. But of course, if we do have, with our complete approach, we want to kind of minimize the process of degeneration. Okay. Okay, and last but not least, we have this term called lumbar spondylosis. So again, if you look at x-rays, they'll say like, oh, you have lumbar spondylosis at this and this level. Okay, so that's a fancy term for wear and tear in the joints in the back. Okay, so spondy means joint, losis means wear and tear. Okay, so lumbar spondylosis. So basically, it's a wear and tear in the joints. It's like osteoarthritis in the back. Okay, so like we mentioned before, if you have too much pressure in the area, and I mean, it's part of the natural aging process, you would have some stiffening and some wear and tear. Sometimes it gets very irritated in the facet joint, and that's where you get your stiffness, you get your back pain. Sometimes you get pain that goes down the leg because the facet joint is so irritated that it irritates the nerve that is around it. Okay, so that's lumbar spondylosis, and yeah, it's basically wear and tear in the back joints. Okay, so as I mentioned before, with wear and tear in the back joints, we want to kind of support the cartilage in the back. Okay, and that's why we usually encourage collagen as well, which I'll talk a little bit more about later. Okay, all right, so enough about the conditions. I just want to hear from you what you think about it. So we're going to do a bit of a poll. All right, so we have a poll, we start a poll, and the main question is if any of y'all has any of these back conditions. So you can help me to answer the poll. Then it helps me have an idea also to see how to make this material relevant to you. Yeah, and at the same time, if you have any questions along the way, just feel free to put in the chat. All right, and then we see if we can have some time to answer those questions for you. Okay. All right. Okay. All right. So I would say majority of you have been told about these conditions before. I think chances are you hear more about slip disc and maybe wear and tear in the back. Yeah, and for those of you who haven't heard of these conditions and just want to learn how to take care of your back, right? I think this is also relevant to you in terms of this webinar, the things that you find in this webinar. Because I'm not saying I'm not concerned about treating, because treating the back pain, that part is more of a short-term goal for me. But for me, I also want to teach you how to take care of your back. Okay. All right. Okay, let's continue. So we'll just end the poll here. All right, thank you for your responses. Okay. All right, so let's move on. So what I want to talk about now is what is the usual process of someone who has back pain and then they want to go and seek treatment for it. Okay, and we want to see what are the usual treatment options that people come across, and we'll talk a little bit more about those. Okay, so when you first get back pain, chances are you go and see your GP, right? Then your GP, some of them might recommend you to a specialist, some of them might go send you for X-ray to check your back. Okay, so when you do a back X-ray, what's a back X-ray for? Back X-ray is to look at the condition of your backbone. Okay, so it's to make sure you don't have any serious conditions, like you don't have any fractures in the back, you don't have any tumors in the back. Okay, and also it gives you a chance to look at the condition of the joints to see whether there's any significant wear and tear. Okay, but the X-ray, the limiting thing is it only looks at the condition of the bones. All right, we don't get much information of the soft tissue. Like we don't get much information about the disc. where this could be the disc could be a source of pain, right? We don't look at the condition of the nerves as well. Okay, so there's a limitation to X-rays, but usually X-ray is like the first line that doctors have to clear first. Okay, so if you go to a specialist, and sometimes they'll recommend you to take an MRI. So the MRI is something like your gold standard. It's like your gold standard of looking at the condition of the tissues in the back, because it can look at bones, but it also looks at your disc, the condition of the disc. It also looks at the condition of the nerves around the area, and for some more better MRIs, right, they can look at the condition of the cartilage in the joints as well. Okay, so MRI is kind of like the gold standard. One limitation of MRI I find as a physio is that a lot of times people use MRI and just blame the disc. Okay, because the MRI can't really tell you, okay, your joint is stiff at this level, right? MRI cannot tell you, oh, your muscle is tight at this part here and it's giving you your pain also. Okay, MRI can always show you the disc, and usually the disc is the easiest scapegoat to blame. So a lot of times, that's why you hear so often that people have slipped disc and you have to treat the slipped disc. Okay, but the thing is, not all the time the slipped disc is a problem. There are many things that are involved in the back, and that's where sometimes, even if I look at the MRI when I treat my patients, I also do a bit more of a hands-on assessment to kind of make sure that I got my bases covered, to make sure I have accounted for all the other possible kind of causes for back pain. Okay, so MRI, yes, helpful, but it's not the be-all, end-all. It just helps me to make my decisions. Okay. All right. So after you look at MRI, they diagnose you with back pain. Then what's the next step? What are the usual treatments? The next step usually is painkillers, right? The doctor will give you painkillers. The doctor sometimes will give you muscle relaxants, ask you to take the painkillers, go home and rest until the back pain goes away. Okay. But the thing is, some people, yes, the back pain goes away. But for other people, the back pain kind of lingers around. And I don't know about you, but I haven't come across anybody who likes to take painkillers. Even with the back pain, some people, even with the back pain, they refuse to take painkillers, right? And yeah, nobody is a big fan of taking medications, and medications do have their side effects as well, especially if you take it for long term. And you have issues like gastric issues. Sometimes I have someone who has loss of appetite because of certain strong painkillers that they are given. And painkillers, we all know, is not a long-term solution. And some people are right to say that painkillers don't get to the root of the problem. Okay. It's not to say that painkillers are bad, but painkillers are helpful to reduce pain in the short term, but it doesn't really get to the root of the problem a lot of the time. Okay, so painkillers, yes, I wouldn't say, okay, then you totally don't take painkillers, all right? There's a role for them, but the role is very limited, okay? Another thing is, some doctors, they are very good. They refer for physiotherapy, okay? So they send you to a physiotherapist to get your back pain treated. So of course, I'm a physiotherapist. I'm biased. I would say physiotherapy is good, okay? Yeah. So physiotherapy has its merits. Okay, so hands-on techniques that we use and exercise prescription that we give, especially if it's very tailored to you, those are very helpful. Okay, but usually for physiotherapy, my critique would be that, you know, a lot of times we go to physiotherapists, and then there are a lot of physiotherapists who just give you a piece of paper with 10 exercises and say, okay, you go home and do all the 10 exercises, you should be okay with your back pain, all right? So in an ideal world, we want to tailor our exercises to your condition, yeah. But in the real world, especially for some physiotherapists who are a little bit more hard-pressed for time, and I understand their concerns, then it might not be so tailor-made. It's a bit hard for them to tailor-make the exercises for you. So that's one critique. Another critique is also, physiotherapy can be a slow process in terms of the recovery. So it's very effective, but it takes time. It takes time for the effects to kick in. And some people want the effects to be a little bit faster. Okay, so physiotherapy is good, yeah, but there are some limitations to it that even I have to acknowledge. Okay, and some doctors, they give glucosamine, right? So they say, oh, the back pain, oh, I see on the x-ray or I see on the MRI, you have some wear and tear in the back. Okay, take some glucosamine. Okay, but glucosamine is not really that great in terms of, especially for back pain. And in terms of knee wear and tear, knee joint wear and tear, it's already not really that great, because we see in an article by Harvard, this is an article by Harvard, right? They looked into studies of glucosamine, okay? And this is done in 2016. There was a study that looked at knee pain due to osteoarthritis, and they were giving these study subjects glucosamine, and they actually had to stop the study early because it became very obvious that for these subjects, right, the glucosamine was making their pain worse, so they had to stop it, right? Yeah, more and more of their subjects were getting more knee pain after taking glucosamine. But of course, I mean, that's not always the case. In terms of my patients that I see, most of the time they just say, I don't feel anything, you know, but you know, my doctor just prescribed me this big bottle of glucosamine and he tell me it works, then okay, I trust him. I'll just take and see how it goes, but it doesn't really help my back pain. Yeah, so glucosamine, and in terms of the guidelines also, like the proper medical guidelines that is published by big organizations, glucosamine is not really the thing to go to. You don't prescribe glucosamine straight away when you want to deal with back pain issues. Okay, so glucosamine, not very effective. Okay, sometimes they might suggest surgery, especially, oh, you have a slip disc, maybe you need to go and do surgery. Well, surgery to me is a little bit of a last resort kind of thing. I won't straight away jump into surgery. Reason being that we want to cover our bases first. We want to make sure that we have done what we can non-surgically and see whether it's effective before we jump into surgery, right? Because you see, you go in and you try to take out a disc, but what if the disc is not the problem? What if it's something else, right? So you spend a lot of effort going through the surgery, right? You take out the disc, and then the back pain is still there because maybe the pain is not even from the disc. Sometimes they will do a procedure called a fusion. So a fusion means you put in rods and screws to kind of fix two levels together. Okay, so that's a very common procedure. The whole idea is to stabilize the spine. Okay, but in terms of surgery, we have to think very carefully because it's a one-way ticket, right? Once you go for surgery, right, once you put all these rods and screws in, right, there's no way of taking it out. Okay, so it's not to say that, okay, after I do the surgery, right, I feel it's not helping, you know, I still have the back pain. Okay, I want to take it out. There's no such thing. Once it's there already, and it's there forever. Okay, so it's a one-way ticket for surgeries. Another thing I find also for fusion, at least for fusion surgeries, is that sometimes the problem in the back is stiffness. Okay, but if you fuse two levels together, right, it will become stiffer and stiffer and create more pain. And the problem is you can come to me and I can tell you that, sorry, I can't do much for you because they're fused together already. I can't help you loosen them up. Okay, so that is a possible problem with surgery as well. It's pretty irreversible. Once you commit already, that's it, one-way ticket. You have those things, it either works or it doesn't work. If it works for you, very good. If it doesn't work for you, then you have to live with it for the rest of your life. Okay, and yeah, so that's why I always tell people surgery is a last resort. Make sure you try every single thing already under the sun, then you do surgery. Okay, but I have a disclaimer. Sometimes emergency surgeries are important, okay? So sometimes when you really have a compressed nerve, so compressed nerve that I was talking about just now, where you really have no feeling, it's really, when you take MRI, it's really that disc really pushing on the nerve until the nerve is gonna die. Then yes, those are emergencies. Those have to be dealt with, and you might need to do surgery for those, of course, according to doctor's discretion. But there are cases where you need to do surgery. There aren't really no choice, but few and far between. Okay, so another thing is surgeries can be pricey as well. So this is something this is a benchmark from MOH that I picked up from MOH website sometime last month. Okay, so what MOH does is they look at the bottom 25% and the top 25% of patient charges in terms of back surgeries. Okay, so you can expect to be paying about $25,000 to $40,000 just for one back surgery. Okay, so it's a one-way ticket and it's a big commitment, both in terms of committing your body to the rods and screws or whatever procedure that the surgeon recommends. And it's also committing a lot of finances to it as well. Okay, so that's why surgery has to be thought of very carefully, and it shouldn't be something that you jump into straight away. Okay. All right. So some of y'all might have gone for chiropractic, right? The chiropractors, what they want to do is to help you with your alignment of the spine. So they send you for X-ray, they look at alignment, and they do their manipulation or stretches to help you to get back to alignment. Okay, so for chiropractic, last time as a physiotherapist, as a younger physiotherapist, I used to be very anti-chiropractor, right? Every time people talk to me about chiropractic, I'm like, oh, no, it's very bad. Okay, but after having 9 years of experience, okay, I slowly shift my mindset a little bit. So chiropractors, I would say it works for some people and it doesn't work for some people. All right, it's up to you to try. But the thing is, for chiropractors, right, I would say they are very good at what they do, right? But they're very good at the one thing that they do, okay, which is that they only have one tool, okay, and they use that one tool to fix a lot of problems in the back. But the back is not so simple as just alignment. The cause for back pain can be a lot of different reasons, right? So my example I give to a lot of people is chiropractors, for example, they are very good at using a hammer. Okay, so it so happen your back pain, the problem with your back pain is a nail, then they'll be perfect for it. They hammer the nail in, boom, job done. Okay, but back pain is not always a nail. Sometimes it can be a loose screw that you need to screw back in. Sometimes you need to glue parts together and strengthen them. Okay, and a hammer just won't cut it. Okay, so for manipulation, for cracking of the back, there's also, from a physio perspective, there's also a very narrow range of back pain conditions that respond very well to cracking of the back. Okay, so for us, based on the research, to have good effects from cracking the back, okay, you need to fit a very strict criteria for your back pain, so that the cracking will work for you. So for example, your back pain episode has to be less than 16 days old. You have to be stiff in one hip. Yeah, all these kind of strange criteria, right? You have to tick all the boxes first. Then it's appropriate to do cracking of the back for you. And the thing is, for cracking of the back, right? Once you fit all the criteria, right? They find that 90%, over 90% of cases, their back pain will be treated within 1 to 2 sessions. Okay, if you fit all these narrow criteria, 1 to 2 sessions, crack, 90% of the time you're done. Okay, so that's the thing about cracking the back. It's not to say that it's wrong, but I would say the kind of back pain conditions that they treat is very narrow range. Okay, so some people respond very well to chiropractic, but some people may not fit the criteria. Then that's why they don't respond so well. Okay. All right. Another thing about chiropractic is they require a lot of sessions. Right? I'm sure some of you all at least would have come across chiropractic packages. They say, okay, come in 3 times a week for the next few months. Let's do intensive, like wow. And you have to keep maintaining this. So for the rest of your life, you have to come in and do 3 times a week. Okay, so you have to commit to about 40 over sessions. Sometimes you even have to commit to over 90 treatment sessions. Okay, and honestly, even for me, I feel I don't have time for that. I don't have time to go down to a clinic for half an hour, 45 minutes, 3 times a week, right? Nobody has time for that. Okay, so that's the difficult part of chiropractic, to commit to their treatment sessions. You have to go down so consistently and you have to really find the time for it. So that's a bit difficult lah. That's what I find. Okay, so we are going through the usual treatment options that people gone through. Okay, and just going to start a poll and just find out from you all whether have you done any of those treatments before, those treatments that we mentioned before just now. Have you done it before, so they have a better idea of where we are in this. Okay? So appreciate that if you can help with your responses. And in the meantime, if any of you have any questions, please feel free to put on the chat. Okay, and I will try to answer your questions. Okay, thank you for your responses. Yeah, I will see that majority of your, about 80% of you guys there, you all have actually gone through these treatments before. So these are nothing new to you. You know what exactly is going on when I talk about them. I'm sure you can relate to what I'm saying as well. All right. So now, without further ado, I want to talk a little bit more about our specialty. Our complete approach to treating back pain is a little bit different, and I will tell you a little bit more about why, at least to me, this makes a bit more sense. Okay, so our complete approach, we look into nutrition, which not many physio clinics talk about. Okay, we look into posture fine tuning. That one is still important. And yes, most physios look into posture fine tuning. And also we do have non-invasive therapies. So I'll go through non-invasive therapies a little bit more later. So you have a better idea of what we do. And I'll try to tie these things together to help you see how this makes sense. Okay. So first off, let's start with nutrition. So nutrition, we know is important, right? What you eat, and it helps to kind of supplement your body in terms of the repair processes and things like that. So one thing that's important, that's why I keep mentioning about collagen, because a lot of times people go to glucosamine, but to me, glucosamine is more like the glue that keeps things together in the joint, in the cartilage or your soft tissue. Okay, but the actual building blocks will be your collagen. So in terms of nutrition, it's important to get as much collagen as you can. Other things also, like you see in the picture, right? There are also herbal solutions to help with inflammation. So why do I talk about inflammation? Because with wear and tear, there's a little bit of minor damage, so there'll be a minor inflammation in the area. That's why some people, when they wake up in the morning, their back feels quite stiff and sore, but after moving around a little bit, that clears up. That is a sign of a bit of mild inflammation in the back. So there are herbal solutions, natural herbal solutions that help to at least control that inflammation in the back. Okay, so things like turmeric, like ginger, like boswellia. Okay, so those are some of the things that will help in terms of your taking care of your back. Okay, all right. So, but the thing is, if you want to take the correct amount of collagen, right, to really supplement the collagen, the soft tissue properly in your body, okay, if you really want to take enough, you have to be eating, like perpetually eating your chicken feet every day, you know what, eat, and then together with the chicken feet comes a lot of your cholesterol, a lot of your this and that, other additional nutrients that you don't really need, right? So people are concerned about their cholesterol, right? So that's why out there in the market, there are supplements that specifically extract the collagen that you need without all the extra cholesterol and things like that. Okay, to distill the collagen, take it out, and then put it in a supplement pill for you. And together with that, also usually they add in some anti-inflammatory herbs as well. So this work together very well. The collagen is the building blocks for your soft tissue. So that helps with the repair processes in your joints, even in your disc. Okay, and with the herbal herbal blends, right? With your herbal ingredients, right? They help with anti-inflammation. Okay, so that helps to reduce a little bit of the pain in the back as well. All right. So in terms of nutrition, that's very important. Okay, to help with taking care of your back. Okay, so I'm even looking beyond treating the back pain already. I'm looking into, okay, after you treat the back pain, how do you take care of your back? This is one way to take care of your back. Okay. All right, the next thing is posture fine-tuning. So in terms of back pain, right, and from a physio perspective, not all back pains are the same. Okay, and in terms of posture, right, it's not to say that, okay, everybody must have a straight posture, or it's not to say that, okay, everybody must slouch. It's not to say that. We use very well-researched assessment techniques, okay, to help to analyze the posture for each person, and then to see how we can fine-tune the postures. Okay, so like for example, if someone has that posture B on the left side, okay, how do we go about treating it? Do we have to deal with what's happening at the pelvis, and then how do we do the extra curve in the middle of the back? Okay, so these are the things that we analyze, okay, and we provide tailor-made exercises, okay, they are specific to your posture to help you to fine-tune the posture so that you don't put too much load through your back. What do I mean by that? Means that you don't put too much load through your facet joints, right? Because certain postures, they load up the facet joint like crazy, okay? And also, you don't load up your muscles, because what I find with a lot of people's postures is that your back muscles are working too hard. But a lot of times you're being taught that you need to sit up super straight. Like you see in the picture over there, the lady in the white singlet, she's being taught to be super straight. But when you're super straight, right, the muscles overwork, and that is another source of back pain as well. So these are the kind of things that I usually look into, and I try to teach people to fine tune it. Okay, I teach you how to relax out those muscles in the back. And when you relax out the muscles, then how do you use other muscles to take over the work so that your back is kind of balanced out? It can be relaxed, but still kind of straight, okay? And you're not over straightening. So these are the kind of things that we look into with postural fine tuning, okay? All right. And remember, I was talking about non-invasive therapies. So non-invasive therapies, what we really mean is we do have therapies with medical devices, okay, that help with the repair processes in the body, okay, and also help to relieve pain, especially if you're in the stage of back pain where it's a very acute flare-up, okay. These non-invasive therapies actually work wonders, all right. So one that we use extensively in our clinic is what we call the radiofrequency therapy. So basically, radiofrequency is a energy wave kind of treatment, electrical wave treatment. But of course, we don't zap you, right? We don't give people electric shocks. It's at what we call radio frequency. So you wouldn't really feel much of the electricity going through. But what it does is it encourages your cells to work a little bit better by absorbing more nutrients, okay? So if let's say your joints have a little bit of a injury or damage, right? Then this radio frequency would encourage the cells in the area, in the back, to absorb more nutrients, work a little bit faster so that the repair processes can go a bit faster. It also helps to reduce pain in your pain nerve fibers, okay? So that's why people feel very comfortable with this treatment. In fact, this is the most comfortable treatment in a clinic already. Some people even fall asleep and snore halfway through the treatment. Okay. Okay, so it's comfortable and it's very effective. And I would say this ties in very well with the nutrition aspect of our treatment, because when we supplement the collagen, right, and then we get the cells to work a little bit faster, then you don't have so much collagen floating around, right? You get the cells that need it to use up all the collagen. Okay, so this pairs very nicely with the nutrition aspect, okay, of our treatment approach. All right, so that's radiofrequency therapy, and I find it's very effective. I used to be a very anti-machine kind of person. Like I was saying, I rather use my hands-on techniques. That's part of my training, okay? And I refuse to use any machines. But since I started using this 4 years ago, I never stopped using it because I see the effects. I see the effects, and I see that it really helps people a lot. So this machine has really converted me. There are not many machines that can convert me, but this is the one that can convert me. Okay, so I really believe in this radiofrequency therapy, and sometimes when my colleagues have time, I also ask them to do for me. Okay. All right, and another non-invasive therapy that we do have at our clinic is this thing called pulse electromagnetic field therapy. So it's called PEMF therapy. Okay, so what's this pulse electromagnetic field therapy? The understanding is that everything around us has this electromagnetic field, this small electromagnetic field. So what this device does is it kind of boosts the electromagnetic field around the certain areas that we apply this field to kind of boost healing processes, yeah, and to help with pain relief as well. So I managed to look at this research study on PEMF therapy. Okay, it's a systematic review, which means they look at a broad range of studies. They look at thousands and thousands of studies, and they narrow it down to the most important studies, and they see what is the effect. Okay, so for pulse electromagnetic field therapy, they find that it's very effective for pain relief. For bone unification, why bone unification is because the original purpose for PMF therapy is to help with fracture healing. Yeah, it's actually a NASA study, right, to help with fracture healing. But when they did more of the research, they find, how come it can help with pain relief? And it helps with wound healing. The swelling also go down. So all these things all slowly come in as they did more of the research, and they find that it's quite effective for all these kind of conditions. Okay, and how is this relevant to our back? So our back, as we know, has this mix of soft tissue, connective tissue, right, and your gel and things like that. So your pulse electromagnetic field would help to boost the repair around the area. Also, we have our joints, right? Cartilage, you see there, chronic pain association with connective tissue, meaning cartilage, tendon, ligaments, and bone. So cartilage is there, you have your wear and tear in the back, right? What you want to do is to kind of boost the repair processes in the cartilage as well. And of course, we're looking for pain relief, all right? So pulse electromagnetic field therapy is an up-and-coming kind of treatment that's becoming more popular. Okay, and even there's a team in NUS who developed this device, this pulse electromagnetic field device, to help with people in knee pain. Okay, so if you look in the picture, you pop your knee into the machine, and then they'll turn on the pulse electromagnetic field, and that should help with knee pain. Okay, but of course, this is for the knee. I wouldn't expect you to wear this huge device around you to do it for your back, right? Okay, but it's an up-and-coming field. And if you look out there, right, there are many different kind of PMF devices that you can get, okay? But as you can see, it's not very portable. So you have to have a full body mattress, you have to have a pad, and then you lie down on it, and then wait for the electromagnetic field to do its thing. And as you can see, it's also a little bit on the pricier side of things. Yeah, so there are systems out there, but they're not as portable as we like them to be, and they can be quite pricey as well. Okay, so but PMF therapy is the up and coming field in terms of treatments and is found to be quite effective. All right. So in summary, this is our complete approach. We look into nutrition, we look to supplement the collagen and to use natural herbal products to help reduce inflammation around the area. We pair that up with posture fine-tuning. So we fine-tune the posture to reduce the loading of the back and reduce the sources of pain. Okay, reduce overloading in the back. And then we have our non-invasive therapies, so the Pmf therapy and also our radiofrequency therapy that ties in all these other aspects of our complete approach, okay, and helps boost its efficiency, its effectiveness. All right. So let me explain to you what we do, what kind of program that we have at our clinic. Okay, so we have this back pain recovery program. Okay, but okay, if you don't have back pain and you don't need recovery, you just want to take care of your back, it's also relevant to you. All right, so we do have a nutrition support as part of our program. So it helps to protect and helps with the repair processes in your back joints. And this is a 3-month program. So in 3 months, this should support you to help you start taking care of your back a little bit better. Okay, and usually this is valued about $450. Okay, we have a portable version of a PMF therapy. Okay, so it's portable to the point where you can even put it in your handbag. You don't need to lug around this huge mat or this big machine where you have to pop your whole body inside. Okay, it's a portable solution. It's about this size. It's a loop that generates that feel to provide the pain relief results that you need. Okay, and usually that's valued about $150. Okay, as part of our program, we have online one-to-one sessions because you know, right? You don't want to spend all this time 3 times a week coming down to our clinic just to do adjustments, right? So we provide convenience to you, okay, in terms of online sessions. So what we do in these online sessions is, remember with this postural fine-tuning, right? We want to do a proper assessment for you and do a consultation with you. We also want to follow up with you in terms of tailor-made exercises that we have for you. So those include core control exercises. We look at muscle flexibility, postural strengthening, and we also provide you with the exercise equipment that you need to get started with these exercises. Okay, so why do I keep talking about exercises? It's because we want to fine-tune the postures. There will be some muscles that are super tight that you need to really release out. Okay, so this is where the muscle flexibility comes in. But with postural strengthening and core control exercises, all right, this is where you get the correct muscles of the back to take over the job of those tight muscles, and then it helps to offload. Okay, and this will be tailor-made to you according to your posture. Okay, and this will come through the assessments. All right, and lastly, we also offer you 1 session of our radiofrequency therapy. Unfortunately, that one we can't send to you. We'll probably need to pop down for 1 session, but it's good to do that session to kind of kickstart the process a little bit. Okay, kickstart the recovery process a little bit better. Okay, so this is a support program. It's a recovery program for your back care. Okay, for a 3-month period. All right. Okay, so the total value of this is about $1,009. All right, but just for today, and we only have 10 slots for this. Just for today, right? We are offering it at $997. Why? Because I think it's valuable. It's gonna help you with your back care, and we want to get as many people on this program as possible to start taking care of their back. Okay. And today we only have 10 slots because we have limitations in terms of slots to offer these online consultations and radiofrequency therapies. So we will start the offer, and this offer is only available for the next half an hour. Okay, and once you sign up for this, you can get in touch with us and we'll get you started on this whole process. Okay, all right, but I don't think it's so much about how much you had to pay for it. Let's talk about the benefits. Okay, so I do have people come to me and say that because of this back pain, I can't carry my child anymore. And like my kid is getting heavier and heavier, and I have to take care of my kid. But then the kid is, but then my back is giving me problems. Okay, or some people even they want to carry their grandchildren. They feel they cannot carry their grandchildren because of the back pain, and that's because maybe they should have taken care of their back much earlier, or don't leave this back pain lingering around. Some of y'all might be enjoying golf, right? You all want to get back to playing golf. So this program would help you get back to what you want to do. Okay. And for some of y'all, okay, this picture may not be so appropriate now, but it should be in future, right? We want to get ready for the time that you can go on holiday. Okay. Now we can't really travel, but when you want to go on holiday, you want to be ready for holiday. You don't want to wait for the time to come and then say, oh, too bad I got this back pain. I cannot go on holiday. I cannot walk much. I every time I have to carry my bags, you know. We want to get you ready when the time is right to go for your holidays without any hindrances from your back. Okay? All right. So these are the benefits of taking care of your back. I mean, this goes beyond the program and things like that. It's more about where does this take you, you know? This helps you with the things that mean a lot more to you in your life, okay? All right. But for those of y'all who say that, okay, I just want to come down to the clinic and I want y'all to come down and really assess us properly. And actually with the radiofrequency therapy, we do suggest that you come down first so I can kind of go through all the different aspects, like start you off on some assessments and things like that, and so you can get started straight away. Okay, then this is our clinic address. We are based in Orchard Road at Shaw House. Okay, we are at the 10th floor. And if you want to make an appointment with us, even if you don't get the offer today, if you want to make an appointment with us to come down, let us do an assessment for your back for you, to do all this fine-tuning, you can contact us at the number below and make an appointment with us. And we'll be more than happy to do the assessment for you and just guide you through the whole process as well. Okay? Yeah. Okay, so that is my part of talking. Thank you for your time. Thank you for staying with me and being patient. All right. And I probably spend some time to answer your questions. Okay. All right. So let's get started. Okay. So let's start from the top. All right. So I have a question from someone who says, does an electronic pulse massager work? So electronic pulse massager, what I assume is those that you put on electrical pads on your back and then they'll start to twitch your muscle. Am I right? The electronic pulse massager. Well, I'll just assume that's the case. Okay. So for electronic pulse massager, the ones where you put the pads on and then you start to twitch muscles on the back, those don't really work that well, especially for some people whose posture is a bit too straight. Reason being is that the muscles are already very tight. Okay, so if you have tight muscles and you twitch those muscles even further, okay, you can cramp them up or you can make them feel even more irritated. So electronic pulse massager, I don't think, I will not recommend lah. Another thing is also, at least for me, when I tried it personally on myself, right, I find it very uncomfortable. I find it very unnatural to have something electronic squeezing my muscles for me. So I didn't really like the experience at all. Yeah, for electronic pulse massager. Okay. Yeah, so I hope that answers your question. Does it work? Not in my experience. I don't think it works that well. Okay. All right. Well, we have a lot of questions today, so let's go through them one by one. Okay, so there's a question about how does traction machine work and how effective it is, because the person has used it before and has helped. And is it still used during physiotherapy? Okay, So as I mentioned before, in terms of my training, I'm very anti-machine, and one of them is traction machines. Okay. In fact, when I was studying in school, they didn't even teach me how to use a traction machine because based on the research, they find that traction machines don't really give any lasting effects at all. But of course, I would go back and say that as my mindset about chiropractors change, maybe I have to change my mindset about a traction machine. But I do find that traction machines, if it's helpful for you, then by all means use it. I don't use it commonly in my practice because I find that hands-on technique work just as well, if not better. So, like I say, the complete approach just now, I find it works very well, and I don't need you to keep coming down to do traction. Okay, it's probably helped for you in terms of traction machines because it probably helped to release some of the muscles in the back. For me, there was one time where I tried the traction machine. It actually made my back pain worse. So it's a case-to-case basis. Yeah. Okay. Traction works for some, doesn't work for others. But I don't routinely use in my practice because I find there are other better methods that I can use to help with treating back pain. I don't have to use a traction machine. Yeah. Okay. All right. I hope that answers the question. If not, please let me know. Okay. All right. I have a question. How does the Pmf look like? Okay, so I'm assuming the Pmf that we are offering here as part of our approach, right? So it looks like it's basically a loop. It looks like a loop, okay, with a controller on top. It's an on-off switch, okay. So what we do is we place this loop over the area that has to be treated. So like, let's say, because I mean, we are talking about back pain, right? So we place it over the back area where you feel the pain. Some people like to put over the back area and stick it on with salon pass. There's actually a strap that you can wrap around your back to put that loop in place. And what that loop does is it generates that pulse electromagnetic field around the area so that it kind of helps with the pain relief and helps to boost the repair processes in the back. Okay. So how does a Pmf look like? It's a loop device with a on-off switch. Okay, so that's why it's very portable. It's something that you can put into your handbag and bring around with you, or you can wear around the whole day. Some people, what they do is they wear it on before they sleep at night. Then the next morning they wake up, it's not so sore in the back. Okay, so yeah, that's the Pmf. Hope that answers your question. Okay. All right, one more question. All right, it says sometimes after sitting down or sometimes stand up, feel my back pain. Also walking for too long, need to take short breaks to continue walking. So how to alleviate this pain? All right, so this is a very specific question, specific to the back pain. And as I say, these things need assessment. Okay. But based on this pattern, from what I see, let's see, sitting down sometime. Okay, so sometimes it could be a postural thing. All right. So for this kind of condition, so sitting down for some time, then want to stand up, you feel the back pain. After walk a bit too much, also get the back pain. So sometimes it can be too much tension in the back. But of course, I mean, I need to get in there and really assess it properly to give you an accurate way to alleviate the pain. Because back pains come in all sorts of shapes and sizes. And I cannot just give a very general advice and say, okay, just do these 10 exercises, you're done, you know? Because I don't believe in very general exercise. I need to tailor it to you and your requirements as well. So I'm sorry, I can't answer this question specifically. And it's worth doing a more closer kind of assessment to kind of see what's going on with the back. Why is it like that? You know, because there are so many different ways why there's a problem in the back. Yeah. Okay, so all right, maybe I have time for another 2 more questions before we go. Okay. All right, so we have one question that asks, how long is the RF session? Okay, so RF session can range from 15 minutes to half an hour, depending on the severity of the condition. Depends on how much you need the treatment as well. Okay, yeah, so that's about 15 minutes to half an hour. But of course, we don't just do RF itself, at least not in my practice. Okay, RF is always paired with hands-on techniques, or always paired with exercise prescription. Okay, so that's why it's a complete approach. If not, I would say a single approach already, which is you just come to me and do RF only. Okay, so we have to bring all these together. Yeah, all right. So I hope that answers your question. Okay. All right, we have a question about, does infrared light heating therapy work? To be honest, I don't think so. It's very superficial. Yeah, it goes to a very superficial layer of your body. By the time it reaches a few centimeters in your body you just clear all the heat away, so it doesn't get to the back itself. It might help to soothe the back because warm feels very nice, the muscles relax. But if let's say your problem is a disc problem or a joint problem, it doesn't go deep enough for your infrared lamp therapy. Okay, so that's why I'm not such a big fan of machines because they have their limitations. The best I find is radiofrequency therapy already. Yeah, that's the one that I can trust myself to. I wouldn't put any other machine on myself. Okay, wow, we have so many questions today. All right, let's go through them. Okay, using the Pmf therapy, is there a time limit? No, actually there's no time limit. Okay, the only limit is your battery, your battery life. That's the limit. Okay, or your electricity bill if you use the bigger units. So there's no time limit to PMMF. That's why people sleep with it. They sleep the whole night with it. Okay, the limiting factor, if you want to put it on for a few days, is the strap or the salon pass that you stick it on becomes very itchy and you have to take it off. Okay, so those are the usual limiting factors, right? But the treatment itself, the PMF, there's no limit to how long you can put it. Okay, yeah. All right, I think we have time for one last question. Okay, so they're asking that massage does help. Is it okay to have it often, like every month once? Yes, by all means. If massage helps and you want to do it once a month, that's fine. But of course, we also want to look at how come you need to do the maintenance massage. So is there anything we can do to help to reduce the tension around the area, right? So that's where the postural fine tuning comes in, right? To see whether there's any tension, all right? What is this tension being caused by, and how we can kind of adjust things around so that you don't feel so tense all the time. Yep. Okay. All right. Okay. Right. So the offer is still going on. If you want to get involved with the back care program, right? And yeah, I hope I managed to answer all your questions and managed to answer your concerns and help you to understand back pain a little bit better. Okay. And yeah, actually tomorrow, one of our senior therapists, Pao Xian, she's going to talk more about neck pain. So if you want to join us in that talk, you can join us as well. If not, I wish you all a good evening, and I hope this has been helpful to you all. And yeah, hope to catch up with you all soon. Okay, good night.